CBJ appliance, it's basically standing for a Cantilever Bite Jumper appliance. It is a growth modifying appliance which is designed to improve the position of the lower jaw and corrects the bite. It consists of an upper and lower frames which are glued to the back molars, and then they are connected by the side arms, which helps to bring the lower jaw forward. The upper frame is basically an expander which helps to widen the upper arch before we bring the lower jaw forward. A few appointments are needed in order to custom make your CBJ appliance. So the first appointment being that we place those little small separators between the molar teeth. So we grab them like this and we put them in between the molar teeth, just to create a little bit of space between the teeth in order to make the second appointment more comfortable for you. 1 week later, we get you in to remove those separators, and then we try rings, metal rings. We try them around the molar teeth in order to measure the sizes. Once we have the sizes of the 4 molars, then we take a mold of your upper and lower jaw or a 3D scan, and that gets sent to the lab in order to custom make your appliance. The third appointment is where we insert your CBJ appliance. So we glue the upper expander part and the lower framework. They are glued to the back molar teeth, and then expansion of the upper arch is commenced. So we show your parents how to turn the screw for you. We normally ask you to do about 28 turns, 1 turn each day at night in order to widen the upper arch. So normally I would ask your parents just to get into the habit that after dinner to brush your teeth, brush the appliance so that it's nice and clean in order to start the expansion. And we use this key here. So if you're right-handed, just hold the key like this in your right hand in front of you. Imagine there's a clock here. The blue part is your 3 o'clock. Move this to about 8 o'clock. And then with the patient laying like this, position the screw where the blue part is basically sitting on the upper front teeth. And then you aim to get it in that front hole in the center. Keeping the blue part touching the upper teeth, then we push all the way to the back. Until you push, it doesn't go back any further. And then all you need to do is take it out towards the tongue and out of the mouth. So appointment number 4 will basically be about 4 weeks later, once the expansion of the upper jaw is finished. We'd expect to see a gap forming between the front 2 teeth there, which indicates that you've done a good job and that you've expanded the upper jaw. At that appointment, we insert the arms, which are screwed between the top and the bottom, and that's what brings the lower jaw forward into that postured bite at the front. So with any new appliance, there comes a period of adaptation. So it's something new, it'll take you a while to get used to. So it'll be challenging to talk, to eat, to drink with that new appliance, but with practice, it improves rapidly. There's usually some discomfort for the first few days when the appliance is fitted, and then again when the arms are fitted. That can be in the form of some muscle discomfort or pain around the molar teeth where the appliance is sitting, or some people have some ulcers around the mouth. What helps is to use the orthodontic wax. So if you take a piece of it, mold it, cover the area that it feels like it's rubbing around your lips or your cheeks. You can even take a whole strip and cover the arms, press it around in order just to make it feel a bit more comfortable. Sweet and acidic foods and drinks are generally best avoided because they damage the teeth, but most importantly, sticky or hard things, they can break the arms or they can cause the appliance to be loose. So avoid biting into a lollipop or a chicken bone or opening too wide when you yawn, and simply try the trick of putting your hand below the chin when you yawn so that you don't open too wide. So the CBJ appliance stays in the mouth for about 12 months. Appointments are generally about every 3 to 4 months in order to check the appliance, check the arms, and make the necessary adjustment as needed. Now remember, this is only going to correct the bite. It does not straighten the teeth or close the spaces or so. So that's why after 12 months, we remove the CBJ appliance and then we go into the full top and bottom braces for the second part of your orthodontic treatment to make sure that we've straightened, rotated, crowded teeth, and we have locked the teeth into that new bite that we've just created.